Congratulations on your decision to try contacts. With a bit of practice, you will be on your way to handling your contacts like a pro. But in the meantime, you may be wondering what to do. This is what you need to know to take out, put in, and care for your contact lenses. Before we get to putting in your contacts, there are a few things you need to do to prepare. Namely, wash and dry your hands and put down a mat to cover your drain. To prevent irritation, you should use soap without lotion and put in your contacts before doing your makeup. Be sure to dry your hands thoroughly. You may wish to use a disposable towel to reduce the spread of germs and keep your hands clean. Now, place a mat over the drain to prevent contact lens loss. Now it's time to grab your lenses. Either open your new lens or open your old case. To keep track of which lens is for which eye, make sure to be consistent with the lens you start with. For example, make sure to always take care of the left eye first. Begin by positioning the lens on the tip of your index finger on your right hand, like so. Make sure the contact is in a bowl shape rather than a saucer. The flare edge should be on the inside, not outside. If the contact is inside out, just flip it around while being careful to keep the lens moist with a drop of solution as needed to make handling easier. Putting in your contacts is simple. Look into a mirror and use your left hand to lift up on your upper eyelid. With your right hand, pull down with your middle finger and place the contact on your eye using your index finger. Make sure to open your eye widely, use slow, steady motions, and stay relaxed. Once the contact is in, blink a couple of times. Now let's talk about a few common mistakes. The first is jabbing. You're going to have to touch your eye, it's just part of wearing contacts, so don't be nervous, go slow, and use steady motions. The second is using only one hand. If you don't get your eye open enough, then the contact lens can't get in, so make sure that your eye is open wide by using two hands. The last is shaking. Rest your hand on your cheek to prevent excessive movement. You're not quite done yet. Now that your contacts are on, you need to clean your case. If you have daily disposable contacts, then you can skip this step. Otherwise, dump out your old solution and rinse thoroughly in hot water. Make sure to get the caps and then set aside on a paper towel to dry completely throughout the day. Now that you have your contacts on and your case is washed, go ahead and enjoy the day. But don't forget to take out your contacts before you go to bed. When you're ready to remove your lens, go ahead and prep like you did earlier. Wash and dry your hands and cover your drain with a mat. Taking out your lens is similar to putting them in. Open your eye, look into the mirror, and squeeze the lens. Then, pull the lens off of the eye. Use two hands to keep your eyes open, and make sure to keep your hands clean and dry. Then, place in the center of your case. Make sure that you place the left lens in the left side, and then fill with solution. To keep your eyes healthy, you need to use a clean case and use new solution every night. Don't just top off your old solution, and don't use water. Once done, make sure that the caps are on tightly and you're finished. If you're using daily lenses, just throw out the lenses every night and open up a new package in the morning. Stay with the wear and changing routines that your doctor recommended and your contacts will feel more comfortable, last longer, and be problem-free. After some practice, putting in and taking out your contacts will be an afterthought. Thank you and good luck.